WSAU, Nick, Wausau, Wisconsin, a lib. Go right ahead, sir.
Hi.
I'm here. Go for it.
Great. Thank you for having me on. I was calling in to talk about universal health care.
Yes. What does that mean, by the way?
So a single-payer system, so the government...
What does that mean?
So we all pitch in with our taxes, and that goes into the government, and then the government pays for health care, similar to education and how they fund other things like that.
That's not how the government funds education. We don't have single-payer education in this country. Never heard of such a thing.
Well,
we have about 15,000 school districts. We have different tax rates for different communities, different teachers' contracts, different school boards, different administrators. So what are you talking about?
Yeah, so I would say...
We also have private schools. We have parochial schools. We have charter schools. We have home schools. Matter of fact, now that you mention it, we have more choice in education than we do in healthcare, more and more.
Yeah.
Anyway, go ahead and make your case.
I guess what I would like is a single-payer system.
Well, how would it work?
Similar to Canada, I would say.
Well, how does that work?
Well, you put into the government...
No, I understand. They tax, take your money, and spend it. I didn't ask you that. Any 3-year-old can figure that out. What do they do with the money?
They fund the hospitals. I'm not sure exactly what you're asking here.
I'm asking how this works. Well, let's do it this way. Do the doctors work for the government?
Yes. So they would be public.
What if the doctors don't want to work for the government?
Then they can go to the private sector.
Well, why would we have a private sector?
Why wouldn't we have a private sector?
Didn't you just say single payer for all? Isn't that what you just said?
No, the single payer options. I'm sorry, I missed.
Oh, now there's a single payer option for all.
Yeah, excuse me, I apologize.
Okay, well, how are you going to attract doctors into government salaries when they can work in the private sector? How would that work?
Well, the same way a private market would work for competition. Like
private market doesn't work when they're competing against a massive government leviathan. That's not a private market. They pick up the crumbs. They pick up the little pieces.
Yeah, but everyone cannot work in the private sector. So
why not?
You have public options.
Why not?
Because there would be a public option which...
No. Why can't people get health care in the private sector?
Why can't people get health care in the private sector?
Yeah.
Because it's too expensive.
Who says? You don't even know. You know, if we had more choices, if people could just pick catastrophic, or we had 25 different health care plans that people could pick, of course they could afford it. We used to have special plans just for college students that were a couple $100 a semester. They were all destroyed because Obamacare said, no, it's these 3 or 4 plans, that's it. You go into states now, they have 1 or 2 choices. You have government involved right up to deciding what you can and cannot offer as an insurance company. People's premiums have gone up, their deductibles have gone up. Many of people can't pick the doctors that they want. And your answer is more government.
All right, let me ask you this then.
Go ahead.
Before we had Obamacare, why were 45,000 people, and that number fluctuates obviously, dying each year because of lack of health care?
They weren't.
Yes, they were.
Oh, yeah? Who told you that?
You can look it up.
No, I don't want to look it up. Where did you get it from?
It's a number. I can pull up the study.
Just tell me where you got it from. So anybody can walk into an emergency room. Did they walk into an emergency room?
And then they would go medically bankrupt because they can't pay for it?
I asked you. Well, you don't go medically bankrupt if you can't pay for it. Every hospital in the country has a program for poor people. Every drug company in the country has a program for poor people. States also had pools of money that they used to fill the gap. What's happening here is people who used to be able to afford their health care, less and less can they afford it because of government interference, the centralism. Let me ask you this. Do you think the government should be involved and be in charge of what kind of a toaster you can buy?
It depends on, if you're saying regulate it, yes, because I think we should.
Government should regulate toasters.
Yeah, because I don't want
what do you do?
You're going to burn down my house.
Toasters burn down your house. We have this private system, this UL system and so forth with insurance and everything that makes sure that, hold on, I'm trying to educate you. You don't know everything. You're young, but you think you do. We used to have, and we still have, professional organizations with experts who would give a special certification to products, appliances that you use around the home to ensure that they're properly wired, they have the proper batteries and so forth. And so the government didn't do that. Hello?
Yeah. I'm not sure
The
exactly.
government didn't do that. And yet your knee-jerk reaction is the government should regulate toasters. You see why I can't take you
To a
seriously?
certain degree, yes.
Tell me, who in the government is going to run the healthcare system?
Like
Which department?
specific agency, you can make a department for that.
So you can make it, and who is going to populate this agency?
Workers.
Workers. The same
From
kind of
health
workers that
insurance.
populate from health insurance. So you'll take them out of the private sector to work for the government. Well, how will that change anything?
Because the government will regulate costs as they do in every other modern nation.
Every other modern nation? The government will regulate costs? People come here for health care. We're the ones who invent the drugs and the technologies and so forth. I'll be right back.
Mark Levin, America's passionately cerebral voice. Talk with that voice now. 877-381-3811.
I want you to do yourselves and me a favor, okay? I don't ask for favors, but it's really for you. I'm telling you the truth. I want you to download the Mark Levin Show app. We've made it really easy. I want you to have it.